They turned the temperature down. The baby got really cold, and then he got sick. And she was just so grateful to me for being able to do that, that I knew that there was something, after life as a teacher that I had to do. And, I ended up finding RIPIN, and here I am today. And so that's a story that always sits with me, because I just, it really touched me that I was able to support her through this, but it also really frustrated me that no one would tell her what happened. And I'm sure that happens a lot more times than we can all even think about, never mind know about. So here we are, and I have two other children. I always neglect to say that. So now I have two other children, Seamus, who is 11, and Grace, who is 7. Andrew is now 15. He's in high school. He still has a trach. He's G-tube fed. He's pretty much non-ambulatory. He gets nursing, but he's doing really well. He, is doing really good with his peers and things like that. And so we're very proud of him. But I have had to experience some of this mental health and behavioral health issues since COVID, and since an illness that Andrew experienced recently with my other children. So I'm glad to be here to talk to you today. Karen, you can advance to the next slide. So the first part of this training is kind of the more mundane, what's the lay of the land when it comes to policy in Rhode Island. And so the policy process is really a circular process. It starts off by identifying an issue or a problem. One thing that we identify is that there's not enough behavioral health or mental health providers in the state. Whether you're looking for a child or an adult, there's not enough services. There's not enough in-home and community-based services. And so when you identify that problem and know that there's an issue, and there's enough people saying that there is an issue, you can start to work on setting an agenda to try to rectify that problem. And I'm going to use an example of temporary caregiver insurance, because that's just something I was really familiar with. I was really involved in the whole process of getting it to go through this whole policy process into being passed. And so those of you who aren't aware, temporary caregiver insurance allows for a family member to get paid, sort of like temporary disability insurance, to care for a loved one who is ill or is going through a sickness or has had an accident. Now, Senator Gail Golden had reached out to RIPIN at the time and said, listen, I submitted this bill last year. We haven't gotten a lot of traction on it. We know that there's an issue with having people needing to leave their job or leave their place of employment because they have to care for a loved one who is ill or sick or had a stroke or whatever it may be, in order to help their loved one thrive. So she said, I understand that you guys work a lot with families with kids with special healthcare needs, and we know that these kids sometimes frequent hospitals and have frequent illnesses, and or there's a lack of workforce for nursing and things like that. So, do you think you guys could support this issue? So as they looked at the problem and set that agenda that this is what they wanted to do in the state, they wanted to enact family temporary caregiver insurance so families could have paid leave. They found people to work together with them. So after they define the problem, they think about other people who are able to connect with them to work on that problem and to help them to put this problem into an action item to perhaps rectify it in a way. They knew they were going to have to go through legislation to do this. So they looked at other states, what other states were doing. So at that time, only New York and California had this legislation in law. And so they took the pieces from that they thought would be good in the law, but they also, we're in Rhode Island, we're a different breed, so we're a small state. So they tried to tailor it to what Rhode Islanders would need. And since we already had temporary disability insurance in the state, they looked at how temporary disability insurance was paid for and thought, okay, let's try to tie this into that and have it paid for through the same mechanism. So it's already an existing process that we can just add another section onto. And so as they're making this policy and they're talking to their community, they had to talk to people who really like the bill, like RIPIN, and they also had to talk to people that really didn't like the bill, such as some different employers. And employers were saying, well, if I'm letting my employee leave to go take care of their loved one, that's time that I'm losing in, productivity and whatnot. And we had to help them to understand that, they had asked for 8 weeks in the bill. It turned out that they only got 4 weeks, but we said, like, if you let this employee go because they have to care for somebody, and in 4 weeks, when they could be back in 4 weeks or 8 weeks, in those 8 weeks, would you be able to train somebody to get up to the pace where this person is? And after thinking about it, it was like, no, not really, right? So, so it took a little bit to get them on board, but we talked to all different groups, special interest groups, lobbyists, individuals, those who own private businesses, small businesses, and really had to get everybody on the same page. So once that was done, they designed the policy. So they designed the law, and eventually the law, it took a few years, but eventually the law passed. And when it did pass, like I said, they had asked for 8 weeks, they only got 4 weeks. And in the initial saying of the law, it was just for parents and spouses. And I think maybe there was like one other it might have been like shared living arrangements for the LGBTQ populations who may not be actually married, but they were partners. And so we were very happy with that. They put it out there. They had to now implement this policy. So as looking at it, like, okay, how are the employers going to bill for this? How are the employees going to apply for this? And so thankfully, like I said, we had the TDI in process that was already set up. So we were able to just piggyback on that sort of stuff and put it into implementation. Also had to let the public know about it because it was something that was new. So how do we do that? So working with community partners and other providers, we were able to share the word, spread it around, let people know about it. There was a brochure that was created, and the policy was enacted, and it went on. And so throughout the first year, there was monitoring of that policy, and looking at how it was working for people. Was it difficult? Were people taking the full 4 weeks, or were they just taking a week or two? And if they did take the full 4 weeks, was that enough time for them to really meet the needs of those that they were caring for, so that they could stay in home and community-based settings? And after a year, they evaluated it. So they sent out a survey to everybody who had used it, or the employers who had to, to provide it for their employees. And based on that evaluation, they went back into the process again, looking at, okay, now that we have this in place, what's the new problems that we found out, or what's the new issues? And so every year since, they've been reintroducing the legislation, but with a little bit more broadening of it. So last year it was passed that now it's 6 weeks this year, and in calendar year 2024, it'll be 8 weeks. There's legislation that's being heard tomorrow that enhances it to 12 weeks. And also includes, and as of the legislation now, it includes foster parents. It already included moms and dads. It includes grandparents who can care for grandkids. And so the legislation that they put in that's being heard tomorrow enhances it to 12 weeks and adds siblings and grandchildren to it. So they keep trying to make it a little bit better so that there's more populations that can use this, so that they can help to care for that loved one who may be ill or sick. And so it's definitely like an ongoing process. They included a lot of people in that process, and they had a lot of meetings and a lot of things like that. And so to be involved in this policy process, you have to really know what you're interested in and know where to look for that stuff. I think you can go to the next slide, Karen. Thank you. So in order to do that, you need to engage your policymakers. And when we say policymakers, it doesn't necessarily mean your legislator. It could also mean, somebody in state government, in the Rhode Island Department of Health, or Rhode Island Executive Office of Health and Human Services. So they also have policies that are written. There's regulations and laws that they have to abide by and how they provide services to the public. But one thing that you can do on the Secretary of State's website, which is listed here, is you can look to find out who your legislator is, who your elected officials are. So there's a section on this website, and I'm not going to be able to go into the websites because I only have a small amount of time. But there's a section on the website that says vote. And in that, where it says vote, you can click on that. You scroll down, you insert your address, and it'll tell you who your national legislators are and who your state legislators are. And then it gives you the option to click on them. And when you click on them, it takes you to the legislative website where you can see like their biography, what their interests are, and things like that. And it also, gives you their email address, their phone numbers, where you can reach them with a letter or an email or a phone call. Now, engaging your policymakers sometimes takes a little bit of training or some sort of, which Beth is going to talk about soon, telling your story. So you want to try to connect with your policymakers in a way that makes it so that they remember you and so that you can build a relationship. So I know sometimes with RIPIN, or at least with my role within RIPIN, I try to see if they have a individual in their family or connected to them that might have a special healthcare need, because that would give us some like common ground to start from, right? Or if the issue that you're talking about has to do with mental and behavioral health, do they have somebody in their life who's had a mental or behavioral health challenge and needs to, some support? And so then it helps for them to understand better, because we all know that lived experience is something that, really just puts it out there that, you don't know what you don't know. So when you have that lived experience, you've been through it, you've supported somebody through it, and so it makes it more personal to you. And so also on the Secretary of State's website, there's a way to find like committee work and committees that are meeting and their agendas. I don't recommend just blind searching this site because it is kind of cumbersome, and unless you know exactly what you're looking for, it's really difficult to find the notes and the agendas from these committees. But I do recommend that you reach out to a community organization like MHARI or NAMI or RIPIN to say, okay, this is the issue I'm interested in. Are there groups meeting about this? Are there groups that are getting together that I could become a member of, or just a person of the public? Because a lot of these meetings are open meetings and any public person can attend open meetings. And I think you can go to the next slide, Karen. So you want to do your research, right? So you got to think about what your interest is, what you want to be involved in, and then kind of identify others who are involved in that. So it might be a legislator, but it might be your school. It's somebody from your school district or another parent in the community. There's the local HESs are around the health equity zones that Department of Health works with that work on different issues in the community. And so once you're able to find if others are meeting about these issues, you can also look at current policies and procedures that are going on around these issues. Is there legislation introduced? Is there a state regulation or state law that has to do with this? And is there a way that you can make it better? And, find out, if there's a way that you can provide any public comment or connect with somebody to get that ball rolling in order to be able to make that change that you may be interested in. And you can go to the next slide, Karen. So I did on Monday night, I was able to kind of take everybody through a little blip of how to track a bill and looking at the daily introductions and looking at how to find committee members. There is a section of the state legislative website. And if you see on this slide, it's circled, the legislation little tab is, and then where the arrow is telling you to go is the daily introductions. And that's how we find out what legislation is being introduced in the state. We each day between January and the end of February, typically, we click on that daily introduction. We look at those bills that the Senate introduces and the bills that the House introduces, and we kind of scroll through them and see if there's anything of interest of ours. And if there's anything that comes up of interest, we click on it, we read through it. Sometimes the bill can be really cumbersome. Every bill will have a summary at the bottom that gives you kind of a synopsis of what the bill says or does. Now, it doesn't totally encompass it. So if it looks like it's something you might be interested in, you may have to go back and read through it. But that's how we find out what we may want to get engaged with. And sometimes when you're looking through those bills, there's a lot of blueprint. And if it's written in blue, it's all new stuff that's coming in. Other times there'll be a lot of red and crossed out. And so that means that's stuff that they're getting rid of. if there's blue next to the red, they're replacing that red with something new, such as like right now there's a law to get away from saying retarded into disabilities. So it's like crosses out retarded with the red, but says disabilities right next to it in the blue. If it's just red, it could be that they're just repealing a whole law. That happens sometimes, that they don't think this law is needed anymore and they just want to get rid of it. But typically you'll see either a mixture of the blue and red or just blue as they introduce new pieces or new sections to bills. And at the bottom of the home page of the legislative website, there's a thing called the bill tracker. And you see that little magnifying glass there, and that's what it looks like. You click on that and you can create an account. And once you create an account, there's like a section up top that says manage bills, add bills. And when you add bills, it brings you to this other screen here that's on the right. And where it says bills, you can just type in the numbers, just separated by a comma. You can search them up and you can click on them and add them to your tracker. Now, they make you do an account because this is your tracker. So you can get updates weekly, daily if you want, or not at all. You can just check it when you want to. But when you look at it and you manage your bills, it tells you, has the bill been, well, the bill has obviously been introduced if you're tracking it, but where was it introduced to? What committee is it going to go to? And is it scheduled for a hearing? So you'll see that stuff in there. And then if it has been heard, it'll tell you what the next step was. Like, was it held for further study? Which means that they weren't really sure it was going to be a good bill this year. And it'll only come back if there's a substitute bill for it. You'll sometimes see a sub A where they add amendments to it, or if the House Speaker or Senate President decide that they want it to be heard again, it will come back. Otherwise, it is just kind of dead in the water for this year, and maybe it'll be reintroduced next year. Other times they'll say, Senate Health and Human Service Committee passed, it will go to the House floor and it'll give you a date that the whole, or the Senate floor, that the whole body will vote on it. And you can look also, like where you see where I pointed to the daily introductions, a couple tabs down, there's a thing that says committee membership. So if it is being heard in a committee and you want to submit testimony, you can look up who is on that committee so that you know who to address that letter to when you're submitting testimony. Or if you go in person to testify in person, it's always good to bring written testimony as well, but you know who you're addressing, you know who you're going in front of. Next slide, Karen. So this is the legislative timeline in Rhode Island. Right now, we're towards the end of bills being introduced. Because there's a little bit of a backlog, what happens is when a senator or a representative introduces a bill, it goes to Senate Council, and they're the ones who officially write the bill so that it includes like all the regulation nuances. And then they submit it into to the daily introductions. So there is a little bit of a lag there, but by now most of the bills have been submitted by the legislators, and we're just waiting for them to finish being written and being introduced so that we can see what's coming through. And already, as we said, this week there's hearings, and they've started doing hearings, and those hearings will go throughout May or sometimes June. And then they'll either get passed or not, and go through that whole process. There is a document on the Secretary of State's website that's linked here that shows how a bill actually becomes a law. And you can look at that when Karen sends out the slides to you. And my final slide really is, go to the next one, Karen, and I'll wrap up kind of here. Oh, you may have to click. There we go. So this is a great quote that one of our former executive directors shared with us. And it's, "If passion drives you, let reason hold the reins." And Benjamin Franklin said that. And it really resonated with me because, we can be really passionate about the things that we want to advocate for. And sometimes that passion can turn a little bit into anger or even like frustration. And so when we say things and we're trying to advocate for things, it may be that we don't say things the way we want to say them. Or if we're new getting into this advocacy piece, we may not be prepared to say what we need to say. And so we kind of are trying to just introduce the issue, and we might not say it correctly, or we might not sound like we know what we're talking about. And believe me, when I first started at RIPIN, this happens to me. I mean, it doesn't matter what kind of degree you have or where you are in your life. people get nervous sometimes, especially when you're in the presence of people that you may not know. And so you want to just make sure that if you're really passionate about something, you need to make sure that you're doing your research, you're making sure that you have good data points and you have a good story to tell. So that way, when you do introduce that topic or that issue to policymakers, they value what you say because they can understand what you're saying and they know where you're coming from. And so there's a link on this slide for tips for testifying, which is another great like fact sheet on the Secretary of State website for you guys to look at. And my final slide is now we're going to talk about with Beth, what is your why? Why are you doing this? And this is my family a few years ago. This is my why. This is why I do the work I do and help advocate not only on behalf of my family, but on my community and other families in Rhode Island, because I know if I experience it or some of my colleagues or friends experience it, there's others in the state experiencing it. And we just want to make sure that we're there for our communities and we're there for each other, and we want to make the world a better place. And so that's why we try to work together to make policies that are going to meet the needs of everyone, especially our most vulnerable populations. So thank you all for listening. And I don't know if anybody has any quick questions before Beth starts, or
if you have questions, you can raise your hand or you can post them in the chat and I will try to convey them to Tara and Beth as we go through. There's a lot of us on, so I can't necessarily see everybody all at once. All right, I'm not seeing hands up. But again, if you have questions after the fact, feel free to email them. I will forward them through to Tara and or Beth. And or if that comes to mind later in the session, feel free to post in the chat. Tara, thank you so much. I want to make a point. It's really important that people understand how to use the General Assembly's website and how to look at the different legislation that's out there, and that's really helpful. You are now on a list for us where we will go ahead and forward you out information about really important, this will not be overwhelming, the top 3 or 4 pieces of legislation pending before the General Assembly this year. And so we can really help you when it comes to tracking legislation and understanding when opportunities arrive for you to bring forward your best self to help with advocacy efforts. Okay.
I will just add that we are going to be doing a full Policy 101 presentation. It will be hybrid, held at RIPIN and in the virtual world on Zoom in April. I can give Karen that date so she can send it out, but that way I'll really dive into how to search for bills and all that stuff. So
yep,
I'm gonna put that out there. Thank you.
All right, thanks, Tara. And with that said, I'm going to turn it over to Beth Lamar, director at National Association for Mental Illness here in Rhode Island. Welcome, Beth.
Thank you, Karen. Hi, everybody. As Karen mentioned, my name is Beth Lamar. I am the executive director for NAMI Rhode Island. We're located in Providence, but we serve statewide. I'm just going to share my screen so we can talk a little bit about the organization, a little bit about some statistics that should be helpful to you as you're doing advocacy work in the mental and behavioral health realm. And then we're going to get into the thick of it on how to tell your story. And when we talk about telling your story, that could be your story of lived experience of your own, perhaps a story of lived experience as a family member or a loved one, or even lived experience as a clinician or a community member. So we will talk about all of those things in detail, but here we go. A quick overview. NAMI Rhode Island is the state organization of the National Alliance on Mental Illness, which is the nation's largest grassroots mental health organization. The mission at NAMI is to provide advocacy, education, support, and public awareness so that all individuals and families who are affected by mental illness can build better lives. Next, I have 2 slides here that have some statistics on them. When we're talking about telling our story to legislators, you do not necessarily need to use any of these statistics. These are for your own reference, so you can feel that you're well informed about the issues, or just some of them are really quick, easy facts you can commit to memory. And perhaps when you're speaking about mental health in general, these are things that might help your supporting arguments or your supporting conversations. So I'm going to only point out a few of these that I think are easiest to recall. One being that 1 in 5 US adults experience mental illness each year. And right below that, 178,000 adults rather in Rhode Island have a mental health condition, which is more than 7 times the population of the city of Newport. Those are big numbers. So when we're talking about 1 in 5 adults in the United States, this is a self-reported number, which means it's probably more than that, because there are a lot of people who do not necessarily report about their own mental health experience due to stigma or other reasons. And then 178,000 adults in Rhode Island is a huge number. When we're thinking about 7 times the population of Newport, that's a statistic that goes a long way when you're speaking to legislators, because it gives them some perspective about how many Rhode Islanders are truly affected. On this next slide, we have a bunch more statistics, but the ones I think are of easiest to commit to memory and are probably the ones that'll be used most often in the issues that we're talking about with legislators. On your left side there, that third little box down says, on average, 1 person in the United States dies by suicide every 11 minutes. That's a pretty high number. That's a pretty steep statistic. And in Rhode Island, 106 lives were lost to suicide in the year before this was reported. So that was 21 into 22. And the reason I bring that specific one to your attention, that specific box, is because there are oftentimes, last year there was 988 advocacy work. There's going to be ongoing 988 emergency phone line advocacy work this year, as well as suicide prevention efforts. So those are statistics that legislators need to know. Okay, our organization's national policy priorities include improving health, responding to crises, community inclusion and non-discrimination, and the stopping of harmful practices. When we're talking about improving health, NAMI fights for policies to make sure that people are getting the best possible care, which includes expanding access, ensuring existing access, and talking about parity, or making everything equal, such that mental health services are as available and accessible as any other health services. Promoting early intervention, so that way crises can be prevented, and care integration, meaning that your mental health is a part of your overall health care that you're receiving from all providers. Responding to crises, NAMI fights for policies to make sure that people who are having mental health or behavioral health crises get the help that they need, rather than law enforcement intervention when it's not needed. Community inclusion and non-discrimination. This one's pretty straightforward, but just making sure that all people are receiving all services, including at places of employment, in education, in the community, and so forth and so on. And then stopping harmful practices. So there are a lot of things that are still going on now in 2023 that you might not even know are still taking place, such as solitary confinement and prisons. And these are the things that we want to see ended, because they are not good for anyone's mental health, let alone someone who's experiencing a mental health condition. Specifically in Rhode Island, MHARI is focusing on the following policy priorities, and we have been doing work on these priority areas for several years, but these are all things that are ongoing works in progress. So one being the continued betterment of the Eleanor Slater, now Rhode Island Psychiatric Hospital System, the creation and expansion of mental health community resources and services, appropriate mental health crisis response across the state, affordable and supportive housing, the implementation of the Rhode Island Olmstead Plan, suicide prevention efforts, behavioral health provider reimbursement rate parity, and mental health services and education in schools. And some of the things that we've done towards those policy priorities in the past 2 or 3 years are as follows. So with Eleanor Slater Hospital, for many years, Eleanor Slater Hospital was only admitting patients who were forensic patients. In other words, they were brought to Eleanor Slater Hospital after going through the court system and being determined as needing to be admitted there. Now, It was meant to be that there were also civil admissions or just general folks out in the community who could become patients of that hospital. And those civil admissions have been on hold for several years. And there was really, that should not have been taking place. There was no reason for that to be taking place. It was a problem or an error within the system. And so NAMI was part of the advocacy efforts to get civil admissions reopened and also to try to improve safety in the Eleanor Slater Hospital facilities. Olmstead Plan in Rhode Island. The Olmstead Plan is named for a U.S. Supreme Court case that basically they tried to implement the right, which one would think everybody already has, but the right to services that are least restrictive in the community and of the person's choosing for all people. Now, the Olmstead Act has been around for some time, but there was no Olmstead Plan to make that come to reality in Rhode Island. Now there is a commitment for an Olmstead Plan, and NAMI Rhode Island, among other community organizations, is a part of providing input to make sure that that takes place and is done correctly. Trauma-Informed Schools Act passed so that all school staff and faculty are taught trauma-informed practices, so that way they can interact properly with the students that are in their care while they're at school. Opposing step therapy. Step therapy is a program that requires patients to try less expensive prescription drugs before stepping up to something that is more expensive. And the reason that this can be damaging is because folks who are switching insurance companies, or sometimes even staying within that insurance company, could be required to change medication or discontinue medication that has worked for them for some time, or that the doctor knows perhaps this is the only medication that will work for that condition, but the insurance company would want to intervene and prescribe something that happens to be cheaper. And we all know that that's not effective, because sometimes it can take many years for a prescription medication of any kind, especially with mental health, to be effective. And there's no sense in interrupting people's well-being. Removing barriers to becoming a licensed social worker. This went through last year. There was a written exam in order for people to become a licensed social worker. And the reason that we wanted those barriers taken down such that people didn't have to take the exam is because some folks have difficulty taking tests. Some folks had language barriers that made it difficult for them to pass the test. And that's not a measure of whether or not they're going to be an effective licensed social worker. So we supported the removal of that exam. Childhood preventive mental health care has implemented some new plans in place for youth under the age of 6 to make sure that they get screening, assessment, diagnosis, and treatment that's needed so that they can catch all of those sorts of issues early on in life and set the student or the youth up for success. Increased access to care creates an entry-level licensing program for licensed mental health counselors. And then reimbursement rate parity. Basically, what we would like to see happen is that mental health providers are compensated the same way as all other healthcare providers. And right now, that's not the case. They're not receiving enough payment from insurance companies for their services to make it worth taking insurance in many cases, which is why oftentimes you'll find that therapists and psychiatrists charge out of pocket and do not accept insurances. And we would like to see that change. I've inserted a couple of slides here that may be helpful based on some of the issues that we think are going to be seen before the legislature, probably in the upcoming years. So these are just some supporting statistics about how effective crisis management training can help with law enforcement intervention. So if, let's say that if police were called to the scene of a disturbance and perhaps that person's having a mental or behavioral health crisis, there are proper trainings. So that way the law enforcement who respond know how to respond to someone having a mental health crisis and do not just handle that the way that they would perhaps another arrest or another issue. So that slide and this slide refer to crisis intervention training in Rhode Island and the successes of that training. Okay, now moving on into the thick of the training today, Advocacy Day training under the NAMI Smarts for Advocacy program. These are the things that we're going to learn today. Why are we advocating? How are we going to tell our story? We're going to do a little bit of a practice activity where you're going to write your own story, share feedback with one another in small group setting, and then we're going to talk about what it's like to go to a meeting with a legislator, beginning with why advocate. So we're going to cover a lot of ground in a fairly short time, and to get the most out of the training, there are just a couple of brief ground rules. I would ask that everybody participate fully, especially when we go into the breakout rooms, so that way folks can get the feedback that they need to use their stories when we actually do this in real life, in person, or in writing. And also that you drop any questions into the chat. I'll do my best to answer them in real time if possible. And also I know that Karen is watching the chat to help with that as well. Did not mean to advance my slides. Sorry for that. So we're going to start off by talking about why advocacy is so important. And that's because every American who has a mental health condition deserves the opportunity for recovery. When NAMI talks about the term recovery, that does not necessarily mean a person needs to be symptom-free. It just is about the ability to manage one's mental health condition while continuing to lead a full and satisfying life. Elected officials are faced with a whole host of different issues and interest groups every year. And your personal relationship that you will create with the legislator, along with a well-crafted message, can really make the difference in their attention to and support of our issues. Your story is going to show that mental health conditions are common and that recovery is possible, especially when our needs are met and we feel valued as a whole person. And too few people actually get the care that they need. There's an average delay of 8 to 10 years before people get an accurate diagnosis. And fewer than half of children and adults with mental health conditions receive any treatment at all. Finally, those who receive treatment oftentimes, as I'm sure you all know, do not get the type of services and supports that could be the most effective for them. And yet without mental health care, everyone pays the price. One way is with school failure. So students with a serious mental health condition actually have the highest dropout rate of any disability group. We also pay a high price in unemployment. Very few adults with mental health conditions are able to get the supports that they need to get and retain a job. In homelessness, over one in every 4 people who are homeless are experiencing mental health conditions. In criminalization, untreated mental illness can get people into trouble with the law, and our jails are filled with people who are experiencing mental health crises and mental health conditions who probably would not be there if they'd gotten the care that they needed. And then lastly, without mental health care, we can sacrifice our future to suicide. Every 13 minutes, actually, that's updated, every 11 minutes, we lose a life to suicide in this country. What can we do to change the situation? We can talk to our legislators. That's why we're all here in this training today, to find out how we can do that. Legislators respond best to the people who they know who live in their district. So we're trying to create that relationship. Hundreds of bills land on their desk every year, and a personal story increases the chances that they are going to take action. Building good relationships with your legislators is important because they make the key decisions about laws and budgets that control who can get what type of care, for how long, and at what cost. So your personal experience, if brief, focused, and well told, will support the legislative ask. We're going to use that term a lot today, the ask, which will save lives and help to save taxpayer dollars. Now we're going to look at the valuable role that you all can play as grassroots advocates. One reason that people don't contact their legislator is because they don't think that they know enough about the issues. But according to research, stories that help the listener to stand in your shoes are far more powerful than facts and figures. Any lobbyist will tell you that real stories, if they are brief and sincere, are advocacy gold. They're one of the surest ways to gain support for mental health care and to break the stigma of mental health conditions. So as we're going through this training, keep these thoughts in mind. Your story is always right. Your lived experience has value and meaning, and you don't have to have all of the answers. You just have to have a clear ask. We're going to go through a few tips right now, beginning with this. Keep your story brief, just the highlights. We live in a world of sound bites and text messages, and legislators are also very busy. So we're going to aim for our story to be about a minute or two. I'm sure we could all tell volumes about what has happened to us and our loved ones and our community members, but you're going to lose your listeners if you give too much detail. So we're going to design this like a movie trailer, where in 30 seconds you get all the highlights and then you want to know more. That's the effect that you want to achieve with your story. Tip 2. We mentioned that stories evoke emotion are very powerful. So we're going to try to use vivid language to place the listener in your shoes. Paint a picture of what you or your loved one went through, what helped, and what life is like now. However, if your story causes you to cry or become emotional, it could overwhelm others and then they might shut down. If your story brings out emotion without causing you to become overly emotional, it'll help to move others. So it's about balance. If you think that your story is starting to hit too close to home, focus on the parts of it that don't bring up as much pain, or try to use language that allows you to maintain your composure. The more that you practice, the easier it will become. Another tip is to use positive concepts like hope and recovery whenever possible. If your story doesn't have a hopeful aspect, like someone or something that helped, then you're going to describe what would have helped or what could help other people. Hope is a very powerful motivator for policymakers because they want to invest taxpayer dollars effectively, and they need to know that recovery is a real possibility. Last but not least, we're going to make an ask. This is a critical step that a lot of people leave out. We're going to thank the listener for hearing our story, and then we're going to put them on the hook by asking if you can count on them to support your issue. If your listener answers with a clear yes, thank them for their support. If it is a clear no or a vague response, you're going to thank them for their time, and then let them know that you want to serve as a resource on mental health moving forward. Regardless of the response, plan on following up, which can help them to shift their opinion, build their knowledge, and perhaps even become a supporter or legislative champion. Now we're going to show how these tips can be used to tell a story with a specific ask in under 2 minutes or less. I'm going to read a sample story from the curriculum. It's not as specific as it could be, and this came to my attention when we delivered this training the other day. This is just a template that we're going to use. We can talk about some of the specific issues that legislators are going to be hearing this year to make it more specific, to clarify that ask that I keep referring to. So this story is being told as though the person was giving testimony at a legislative hearing, but this same format, the same template can be used to fit other situations as well. And I'm going to read this. Hello, I'm Shannon Johnson from Springville, a member of NAMI Springville, which is part of America's largest grassroots mental health organization, National Alliance on Mental Illness. As a person who lives with schizophrenia, I would like to share my story with you and ask for your support on mental health services. I was married and had a successful career in business. I worked hard and I never imagined that I would experience mental illness, but I did. I started seeing a therapist after experiencing nightmares, nervousness, and a lot of problems with going to work. I thought that with a few visits to a therapist that those problems would be over, but my symptoms got worse and worse. Eventually, I lost everything. With the help of a psychiatrist who diagnosed me with schizophrenia, I found my way back again. I will always remember him telling me that schizophrenia did not need to mean that my life was over. He gave me hope. Today, I'm proud to be working again and volunteering with NAMI's In Our Own Voice program. Many people have mental illnesses like mine, but not everyone gets the help that they need. A strong mental health system helps more people to get the right care at the right time and experience recovery. Thank you for meeting with me and for listening to my story. Can I count on you to protect mental health services? So now that we've listened to the sample story and we've heard about its impact, we are going to talk a little bit more about how to develop our stories. Using this example, does anyone have any feedback about what might have moved them in that story or what really caught their attention?
I noticed that like saying what worked for them and like the motivation and hope part.
Good. Motivation and hope. Anyone else? Okay. What we're going to do next is to put together our own story. So I'm going to give you some time to put that together. And I'm going to leave this screen up that you can see right here. This is what we call the 7 steps checklist. It's also sort of an outline on how to write your story. And you're going to refer to this in order to take your thoughts and turn it into that 1 to 2 minute soundbite that we were talking about. I'll give you a 2-minute warning before we are ready to come back to the larger group, but you're going to have 15 minutes to fill out a story of your own. You're going to use these steps, but they don't necessarily have to be in order other than the introduction, just to check and make sure that you've included everything that we need to include. So introduce yourself, say your name, where you're from, your organization, if you're representing one as a client, as a clinician rather, or community member. You're going to talk about how you personally are impacted by mental illness, state your issue, what it is that you want the legislator to do, what happened to you or your loved one or your clients or your community before the help was received. What was the help? What worked? How are you or they different today? What is the need or the problem? And then what will help others? And then lastly, thanking them for their time. So I'm going to leave this up. You'll have 15 minutes. Karen, would you like to just input perhaps like some specific issues, as we mentioned on Monday, that folks might want to tailor their story to?
Yeah, so there's 3 primary issues that our organizations are collaborating on. One is a piece of legislation introduced by Representative Tansey that would increase the what behavioral health professionals are paid by insurers for the services that they provide. This is really important because mental health professionals are paid as much as 24% less for the treatment and management of services of conditions, chronic mental health conditions and substance use disorder than are similar specialists and practitioners on the physical health side. So like, think of it as comparing like a mental health counselor to a someone, you know, providing ongoing management for someone with diabetes. The person helping the person with diabetes is getting reimbursed $100 compared, that's a made up number, by the way, but let's say $100 compared to $80 that the mental health counselor, who still has an office to maintain, who still has the technology to maintain, who still has to support their own family and maybe pay support staff to assist them. So this is a very important issue. And that's a bill that is before our state General Assembly this year. There's also going to be a bill, it's not introduced yet, so we don't have a bill number. You're going to get information about all of this too, by the way, so don't worry about remembering everything. There's another bill that would provide state investment and support to make sure that our state's 988 suicide prevention line has the funding and resources that it needs in order to help reduce the rising incidence of suicide in the state. And then another example of legislation is the effort to make sure that our state community mental health networks transition to certified behavioral health clinics is funded at the level it needs to, so that those entities can provide the level of service that the community needs to meet the need and make sure everybody, regardless of their income, has access to the full range of services they need. So those are just 3 examples. There's Beth noted some other ongoing legislative efforts, and we will keep you apprised as once all the legislation is in place and we have a nice clean list of here's the bills and here's how this is going forward. But if you want to tailor, if you have been challenged with at any time being stuck on a wait list, not being able to find an outpatient mental health provider, any of those circumstances, those are good things to address specifically in your ask. But it might be our kids need ongoing access to information in the schools. Our teachers need to be better educated, whatever. You can tailor your ask around that. I hope that's helpful. Did that answer?
Yeah,
Okay.
that gives folks some focus for their story. And if none of those are things that you see yourself advocating for and you want to, like maybe you came here to this training already with an issue in mind, you may use that as well. So it is 12:30 right now. I'm going to run a timer for 15 minutes for you all to practice writing your story using this outline. If you need any help or you have any questions, just drop that into the chat and then we will begin right now. So I'm going to leave. Thank you, Karen. I'm going to leave these steps up so that way you can refer to them as the folks in your small group share their stories with you. Be sure that you're paying attention to the time. We want to make sure that those stories are 1 to 2 minutes and that they're including all of these things. Share with the folks in your group the things that you thought worked best and maybe some things that they could add as constructive criticism. So I'm going to put everybody into assigned breakout rooms. Give your partner a minute or two to share their story, and then take about a minute or two to provide feedback, then move on to the next group member and so forth. I'm going to give about, well, what size group do we have? I'm going to give everybody about 15 minutes to do this activity as well. And I will be sure to send you a message into your breakout rooms to let you know when we're coming to a close in that time. That way you don't get bumped out abruptly. So I am going to.
Before people go into their breakout rooms, I just want to, in the chat, this is Karen, I put the link to register for part 2 of this training. For those of you who may not already be registered for it, there is a part 2. Beth's going to be doing more work with us all, specific to state and federal budget making, which is where a lot of the work happens on our systems of care. And that part 2 session is scheduled for March 15th. And I put the link to register for it in the chat because I know some of you may have to sign out quickly. I wanted to get that in there.
Okay. And with that, I am going to send you all off into your breakout rooms.
Struggle.
Apologize. I got a reminder to turn the recording back on.
So I struggle with organizing my thoughts, following the steps. I couldn't help to notice that I have so much to say. And I try to keep data and information and be structured and struggle with organizing. So I'm glad that you said this is your draft. Don't worry.
Oh, yeah. And I mean, the more that you practice, the more the more ease it will feel when you're telling your story. The first time you feel like you said, you've got all these thoughts, you've got all these ideas, you know, you only need to turn it into a 1 or 2 minute thing. And sometimes it's hard to articulate those points into a 1 or 2 minute explanation, but the more you do it, the more off the cuff it will feel, the more natural it will feel. So keep practicing, talk to one person and then maybe 2 people, and then maybe a small group that you work with or who you live with or whatever, until it becomes like that, more second nature. Anybody else want to share their feelings? Okay. All right. So now that we've all drafted our stories, you can polish that up. Like I said, that is a draft. You're going to work on that over time, and you're going to use that as a foundation for your advocacy work. And then with just some small minor changes, you can target that same story to different audiences or to use it for a variety of different issues. Your story is going to drive the point home by helping a legislator or a lawmaker or a policy person to understand what it's like to live with a mental health condition. And most importantly, by helping an elected official or decision maker see things through your eyes, that's going to build a relationship. And building a connection with them is far more important than just powering through a bunch of statistics and points, because the relationship increases the fact that they will remember you, remember the issue, and then act on requests that you might have in the future as well. However, we of course want any of our meetings with legislators and decision makers to make as strong as an impression as possible. So not necessarily with legislators, but just in general and work in life. What are some things that make a meeting good? Anyone? What makes a good meeting?
People can just speak up.
Sticking to the agenda.
Sticking to the agenda, definitely.
Showing up on time and appreciating the person's time that you're borrowing from.
Definitely respectful of time. Yeah.
Making a connection.
Making a connection. Absolutely. What are some things that could lead to an ineffective or disappointing meeting? Anybody?
Just being spoken to.
Mhm.
Yep. No interaction, just being spoken to.
Being all over the place.
Unorganized, all over the place. Sure. Okay.
Feeling like not everybody has a chance to be heard.
Yes. Yep, absolutely. So keep all of those thoughts in mind as we go through some tips and tools to strengthen how to have an effective meeting with legislators. Tip number one is to know your issue. So you're going to get a packet of handouts, as Karen had mentioned in the chat before, which include all of these tips, the tips for telling your story, the tips for having a meeting, and then there are other handouts that you can use to create an effective meeting that are outlines. So the first, like I said, is to know your issue. The policymaker that you're meeting with expects you to be meeting with them about something specific, not just come chit chat. So having some clarity about the issue that you're going to discuss and what position you want them to take is vital to having an effective meeting. There is a handout in the packet I just referred to called the briefing sheet. And the briefing sheet basically is a checklist like this, but it's in box form, so you can fill it in, where you can put down your problem, the solution that you see, how to make the ask, just like we did when we were telling our story, and who those key players and the action are. If we have a few minutes towards the end, I can show you what those handouts look like. Otherwise, you'll receive them in email anyhow. And if you have questions about them, you can contact me directly. The second tip is to know your policymaker. This can, of course, build a stronger connection, like we keep saying, but also build a more targeted message by knowing and understanding the elected official. And knowing the policymaker can help you to choose what you say, how you say it, which legislators you even want to meet with. So there's another handout in that packet called the backgrounder. And the backgrounder is a nice little outline where you can insert a photo of that elected official, some information about them. How long have they been in office for? What kind of bills have they supported in the past? What committees do they participate in? That shows the kinds of interests that they had. You want someone, if you're going to speak about mental and behavioral health, you're not looking for someone whose primary issue is perhaps the environment. You're looking for someone who is interested in supporting the issues that you're interested in supporting. You might also want to take into account some things like what they do in their spare time, what they do for work. I assume everyone knows, but I should not make that assumption, that our legislature is a part-time legislature. So many of those folks have regular like day jobs that they go to prior to participating as legislators. Tip number 3 is to plan out the meeting. You're going to excuse me, plan the visit in advance, because it can be really intimidating to meet with policymakers. So you want to make sure you've got all your ducks in a row ahead of time. It'll make you feel more confident when you go. And then there's also another reason to plan. So if you're going to go as a group of people, you want to assign roles as to who's going to do what, so it doesn't feel jumbled and that people are talking over people and that things get lost in the messaging. So in other words, we're going to prepare. Meeting roles, if there are 3 or greater people, one person will take the lead, and they're the ones who will start a conversation, make the ask, and close the meeting. They're like the ringleader of the meeting. Also, you have the messenger. The messenger is the one who's going to lay out the facts and talking points about the issue or the bill. And then you also have the storyteller. And the storyteller is the one who is going to provide that personal experience, that personal connection. If you go to meet a legislator one-on-one by yourself, then you're of course going to play all 3 of these roles. Going in a pair or a group of 3 is usually best so that everybody has like one targeted job to do when they go. And also because going in a group shows force behind the issue, that there are more people than just that one who are interested in the bill or in the topic. Just be sure that you always, if you have a large group, make sure that only those 3 people who have those roles are the ones talking, so it doesn't get too chaotic.
And Beth, can I just interject here? Because I think this is really an interesting point about meeting with legislators in groups. The truth is that our power isn't in money like big corporations have. Our power is in our collective action. And so the more we can do collectively on the issue of improvements in our state's system of mental health care, the stronger we are and the more likely we are to win change. So.
Yes. And then lastly, tip 4, we're going to make an ask. We're going to make a direct ask, just like we did when we were telling our story. If you're talking to a legislator, you want them to know what's going to help other people, and then ask them directly if you can count on their support. That's going to like put them on the hook, so to speak, by asking them for a commitment. And it'll also tell you a lot, because if they commit, then you know that you have a supporter. If they say no, or they're like non-committal and very vague about it, you know where they stand on the issue, and that you need to follow up to continue nurturing the relationship and continue informing them about why this is such an important topic. Don't take a negative or a non-committal response personally. Your legislator is probably under a lot of pressure from all different sides and might also be balancing a lot of other issues and topics. I'm just going to zip through this. We are not going to do a practice meeting, but there is one in the handout packet. So I want to leave this portion open for a couple of minutes if anyone has any questions. If not, I can move on to show you what those handouts look like. Did anyone have any questions before I take this screen down and move to the other? Okay, I'm going to stop sharing for 1 sec so I can switch tracks here. And then I am going to reshare my screen. Here we go. So these are the handouts that are going to be in your packet. There's a sample story for, I think, 4 different populations. And of course, you can tailor any of these stories to any sort of legislative action. But we have a sample family member story. We have there's also a sample peer story, a story of loss, and a sample provider story. We have the 7 steps story checklist that I displayed on the screen when we were working on our practice. There's also a blank practice story sheet, and you can make as many copies of this as you need. You might want to tailor your story differently if you're going to advocate about several different bills, or if you're going to provide testimony ongoing, maybe this year, next year, whenever that is, you can refer back to this to help you narrow that story down. We also have just a general list of tips for advocacy. Kind of sums up some of the things that were in the slides. The briefing sheet that I talked about a couple of slides ago, the briefing sheet is where you're going to put the issue. If there's a bill, you're going to put the bill number. If it's just a topic like perhaps budget for the 988 phone line, you just put that in the issue column. The ask is what you want the legislator to do. You either want them to support the bill, you want them to oppose the bill, you want them to allocate dollars, whatever it is. Then the need or the problem, all of your talking points that you're trying to consolidate into your meeting with the legislator. And then the sponsors. So if we had been able to look earlier on the General Assembly and or Secretary of State website, you would see that you can track bills. You can go on there, find out what's going on or has been passed. And when you do, the summary of them will show you who the sponsor of the bill is, will be listed first, and then any other co-sponsors will be listed afterwards. You might also find this information within each legislator's bio on the General Assembly website. The briefing sheet to run off copies for yourself. The backgrounder example, this is where I was referring to pulling together some basically like biographical information about your legislator. You can plug all of these things in. You can lift their photo, right from the General Assembly website, so you know who you're looking for if you're going to go up to the State House and you've never met them before, along with the contact information for that legislator, all of the things that they do as in their role as a legislator and also in their regular life that might be helpful to you. And then there are also some blanks, a blank one in here for you to run off copies for yourself. The meeting roles that I went over about the lead, the messenger, and the storyteller, and the division of the roles, and a checklist for when you go to meet your legislator. And that is if you are doing this, organizing this on your own. And then in your packet, there is an evaluation. Disregard this and use the overall evaluation that is going to be provided by Karen in the email. So that's everything I have for handouts. And I'm going to turn the microphone back over to Karen to wrap us up.
Thanks, Beth. So this is really exciting. I want to just say that you are on a list of grassroots advocates now. And so, like I mentioned earlier, we are going to try and fill some of this information that Beth just went over with you. We're going to try and fill some of that information in for you. I'm going to just share my screen briefly to show you an example of what you might receive from us. I'm going to show you an example of kind of Beth talked about a briefing sheet. Well, here's an example. This isn't finalized yet, but when it is, you'll get a copy of it. This is a fact sheet with some data, statistics, as well as a description of the problem around reimbursement rates for behavioral health professionals. What are the impact of these low rates on patient access to care, and how we can fix it with the appropriate bill numbers and that kind of thing. So we're going to work to make sure you have information about what is happening up at the State House, what the primary pieces of legislation are. And so you'll be getting, in the not too distant future, a copy of kind of a briefing sheet so that you can look at it and say, yeah, I'm going to speak out on this. So that's one point. So you will hear from us about this, and we'll also try and keep you up to date as things are happening. So as hearings get scheduled on important pieces of legislation and this kind of thing, we are going to work our hardest. We may not be perfect, but we're going to do the best we can to keep you all up to date on that. I do want to say there are some opportunities already on the calendar and opportunities already taking place. The first one is that a group of our organizations, NAMI, Mental Health Association, RIPIN, and other groups are working together, and we are working to develop a story bank. So you all have been working on your stories. I know many of you probably want to do some more work on that. As you perfect your story, if you are willing to share it as a part of that story bank, and this is a mechanism we can use with legislators to make sure they are hearing the kinds of experiences Rhode Islanders are having, then we encourage you to participate in that. I'm going to put a link right now into the chat, which is a link to that story form outline. So once you've used the materials Beth has provided and you feel confident, you could go right online, use this link, and that gives you a place where you can share that with the Mental Health Association. Don't even have to include your full name. It can be somewhat anonymous. But it's a way we can point to legislators for, here's an example of the kinds of things that Rhode Islanders are experiencing. So that's number one opportunity, advocacy opportunity that you can take right now or in the very near future. The other opportunity is that Barbara Morse Silva with Channel 10 News has served as the MC for the big rally we have every year at the State House as part of May's Mental Health Month. This is the biggest opportunity for people like all of us to go up to the State House to speak face-to-face with our elected representative and our elected senator. But prior to that big rally day, Barbara Moore Silver would like to do a series of short stories. And one of the things she's interested in doing is interviewing some folks who may be willing to be interviewed by her as a part of her coverage. And so this is an opportunity for you to, I'm going to post Lori Marie Peixoto, who's our executive director at the Mental Health Association. I'm posting her email into the chat. If you feel confident enough, and we can help you with this, I'm sure Beth would be willing to help with this too, to actually be interviewed in this kind of a public way on Channel 10 News by Barbara Moore Silver, who's really a wonderful person, then email Lori to let her know. Or likewise, when I send out the reminder or the follow-up email to this session, I'll also remind you of this. It's perfectly okay if you prefer to just email to me directly or to Beth directly about that, and we can make the connections that need to happen. So that's a second opportunity. The third opportunity is that the big rally day at the State House has already on the schedule. So please write this down and save the date. April 27th from 2 until 4 p.m. at the State House. And we are definitely going to be, not besides having a big event with hundreds of people in the rotunda with speakers and everything, we are also going to be working to have some teams of people talk to the highest priority elected leaders. And this is, so we all have a chance to stand arm in arm in the rotunda to show our power, but we also have the opportunity after the speaking part of the program to visit the floor of the House and the floor of the Senate to speak directly with elected leadership. So April 27th from 2 until 4 p.m. And then finally, we need to hear from you about how Beth, Tara, and I can do better in presenting this Advocacy 101 session. So we are asking all of you to evaluate us. And I'm going to, in the chat, let me get this here. In the chat, I'm going to post a link to a evaluation form that you can use to fill out if you want to take a couple minutes when we close out today to fill that out. But I'll also include the link in my follow-up email to all of you that you'll get by the end of the day tomorrow. That follow-up email will have all of these opportunities I just mentioned, all of the materials that Beth reviewed with you, and feel free to reply back if you have any questions, if there's anything else that you need from any of us. And again, earlier today, I posted the link to register for part 2 of this training, which is happening on, just want to make sure I give you the right date, March 15th, 11:30 to 1:30. And I'll include that link again in the follow-up email that you all receive. So I think that's it for me. Have I covered everything, Beth? Have I forgotten anything?
No, I think that's everything also.
Yeah. So unless there are last questions here now, I think we can close up, and we'll be closing up even 4 minutes early, which is terrific. You'll all have a few extra minutes in your day.
Thank you, everybody, for coming.
Thanks, everybody.
Yeah, thank you.